Hello doctors. Today let's see about an important topic called as circle of Willis. This must be a nightmare for many students, but once you learn it, it is the easiest of all. Okay, let's not jump directly into the brain. Let's go from the heart and we'll trace out the blood supply from the heart. Let's assume that this is the heart and there is arch of aorta. The arch of aorta gives the coronary arteries and it also gives brachiocephalic artery. The brachiocephalic artery divides into right subclavian artery and the right common carotid artery. Then the next branch of the arch of aorta is left common carotid artery and the third branch is left subclavian artery. So if you see guys, this is the right subclavian artery, this is the right common carotid, left common carotid and left subclavian artery. The first branch of the right subclavian artery is the vertebral artery. Same in the left subclavian artery. First branch to be is vertebral artery. The common carotid arteries are divided into internal carotid arteries and the external carotid arteries. Internal carotids and the external carotids. This is the vertebral artery. This is the vertebral artery. So internal carotid artery. This is internal carotid artery. If you see that both the internal carotid arteries supply the anterior part of the brain and both the vertebral arteries are going to supply the posterior part of the brain. So if you see, the brain is being supplied on the anterior side by the internal carotid artery and the posterior side by the vertebral artery. Both this vertebral artery and the internal carotid artery will join in the brain to form the circle of Willis. Okay. This is the circle of Willis. Okay. Now let's go to the brain and see about the circle of Willis. Now let's see the circle of Willis at the brain. If you consider this is the brain and spinal cord, there are two vertebral arteries running this way and supplying the posterior surface of the brain, and there are two internal carotid arteries running like this and supplying the anterior surface of the brain. At the under surface of the brain, these vertebral arteries and internal carotid arteries form the circle of Willis. This is how the circle of Willis is at the brain, at the under surface of the brain. Now let's study about the circle of Willis at the under surface of the brain. If you turn the brain upside down, you can see the circle of Willis. There is usually two vertebral arteries combining together to form the basilar artery. So, two vertebral arteries forming the basilar artery. Known as basilar artery. This basilar artery gives posterior cerebral artery. Posterior cerebral artery. Now, you can see the anterior surface. There is internal carotid arteries. These internal carotid arteries gives rise to middle cerebral artery. Yes. Middle cerebral artery. Now, from the middle cerebral artery, there is anterior cerebral artery. Anterior cerebral artery. Now, if you see, the middle cerebral artery and the posterior cerebral artery are connected by posterior communicating arteries. Same, the two anterior cerebral arteries are communicating by anterior communicating arteries. Now, if you see, there is more or less a formation of a circle. This is called as circle of Willis. Now, important point to be noted is that the middle cerebral artery does not form a part of circle of Willis. So, you can get this question, which is not involved in circle of Willis? It is the middle cerebral artery. Now, let's see the important branches of the circle of Willis. To begin with, there are few branches to be noted at the level of vertebral artery. There are two posterior spinal arteries and one anterior spinal artery. There are two posterior spinal arteries and one anterior spinal artery. The vertebral artery also has the branches pica, that is posterior inferior cerebellar arteries. Posterior inferior cerebellar arteries. Now moving upwards at the level of basilar artery. Basilar artery gives branches to anterior inferior cerebellar artery, which gives the labyrinthine artery, which supplies the inner ear. So the inner ear is supplied by the labyrinthine artery, which is a branch of anterior inferior cerebellar artery, which is a branch of basilar artery. The basilar artery also gives branches like medullary branches and pontine branches. That's the medullary branches and pontine branches. It also gives superior cerebellar arteries. Superior cerebellar arteries. Now, these are some of the important branches to be noted at the level of circle of Willis. If you see the circle of Willis, here is the midbrain and here is pons and here is medulla. Now let's see which artery supplies which portion of the brain. This midbrain, pons and medulla. Now the spinal cord is supplied by two posterior spinal arteries and one anterior spinal artery. Now I repeat, the spinal cord is supplied by two posterior spinal arteries and only one anterior spinal artery. Now if you see the medulla is supplied by two posterior spinal arteries, one anterior spinal artery, the posterior inferior cerebellar artery, the vertebral artery, and medullary branches of the basilar artery. So, medulla is supplied by the posterior spinal arteries, anterior spinal artery, posterior inferior cerebellar artery, the vertebral artery, and the medullary branches from basilar artery. So, 5 arteries. The pons. Pons is supplied by anterior inferior cerebellar artery, the pontine branches, and superior cerebellar artery. Pons has 3 main branches. The anterior inferior cerebellar artery, the pontine branches of basilar artery, and superior cerebellar artery. The midbrain is supplied mainly by posterior cerebral artery. Midbrain is supplied mainly by the posterior cerebral artery. The cerebellum, which is located here. approximately here is supplied by all the arteries named cerebellum. For example, posterior inferior cerebellar artery, anterior inferior cerebellar artery, and the superior cerebellar artery. So, these are the main arteries supplying the parts at circle of Willis. If we see few clinical correlates, the aneurysm occurring at the circle of Willis is called as the Berry aneurysm. Berry's aneurysm. The most common site of Berry aneurysm is anterior communicating artery. If you see, here is the optic chiasm. So, if there is an aneurysm at anterior inferior cerebellar artery, it can compress the optic chiasm. If the optic chiasm is compressed, the patient will get bitemporal hemianopia. So, this is a clinical correlation of the circle of Willis, and there are definitely many stroke syndromes related to the circle of Willis, which we'll be seeing in another module. Thank you.